introduce Mike Swick, who's going to introduce our video, and later Mark Fenton. Mike.
Thanks, Jerry. I want to tell a real quick story before I introduce the video, and it really goes back about a year ago when I was asked by Jerry to join this team. And I see Brian here, like Brian Smith, we called one another and said, are you in? Are you in? If you're in, I'm in type stuff. But I will tell you, having gone to Washington, D.C., begrudgingly, I'll be honest, in terms of what we've got, I can tell you, standing up here in front of you, I've been to the mountain. And I will tell you, the aha moment for me, and you'll see it in the video here in a little bit, was when I was sitting there listening and they made the comment that my children's generation will be the first generation ever that is expected to have a shorter lifespan than their parents. And that's never happened before. And I think that was kind of, to me, a very aha moment of holy moly, what's going on type stuff. And when you see the video here, and I think they've done a great job of putting it together in terms of it really lays out what Allen County, the challenges we have, and they're not challenges that we have to turn away and not do. We have to step up. And when you look at it, there's 4 points, I think, the video I'd like to really hit. One is, to me, it's scary because it really lets it out there and tells you what we're about. It's informative, it's educational, but I think the key is it's a call to action for all of us. So at this point in time, I'd like you to look on both screens and see the video.
Obesity costs our country $150 billion a year. In Ohio, the cost for treating obesity-related illnesses is more than $4.7 billion annually. In the United States, approximately 1 in 3 adults and 1 in 6 children are obese. In Ohio, 3.3 million people are obese, or 28.8% of our population. Here in Allen County, 39.9% of third graders and 77% of adults are either overweight or obese. According to the 2012 County Health Rankings, Allen County is among the unhealthiest counties in Ohio, ranking 83rd out of 88 counties when it comes to obesity, teen births, sexually transmitted diseases, and tobacco use. Over the last 20 years, we've watched national obesity rates more than double. In 1990, obesity levels peaked at 14% in some states. By 2010, they surpassed 30% in many states, with no state under 20%. Obesity is epidemic in the United States and a major cause of death attributed to heart disease, cancer, and diabetes. Consequently, today's children will live sicker and die sooner than their parents for the first time in American history. Where you live matters when it comes to your health. In Cleveland, Ohio, a recent study indicated that if you live in an inner city neighborhood, your life expectancy was 64.4 years. In the community of Lyndhurst, just miles away, the life expectancy was 88.8 years. The issue of health can no longer be relegated to political discussion. The connection between health, well-being, and economic impact and growth must be realized and incorporated into a broader political and economic agenda for a community to thrive. Now, imagine an entire community pledging to adopt healthy behaviors in order to live longer, healthier lives. Imagine a community that becomes happier, healthier, and more connected. Activate Allen County, Pioneering Healthier Communities is a community-wide health movement aimed at reducing obesity in Allen County. Communities can expand access to fresh fruits and vegetables through farmers markets and mobile produce programs. We can advocate for healthy vending policies, healthy food, and physical education programs in our schools. Local governments can implement traffic safety measures and build sidewalks, crosswalks, and bike paths. Mixed zoning can allow easier access to schools, businesses, and grocery stores. Activate Allen County, Pioneering Healthier Communities is focusing on 5 strategies to make this happen. Strategy number 1, educate our leaders, developers, bankers, business owners, and elected officials about the relationship between policy, environment, and community design to positive health outcomes. Strategy 2, implement campaigns on physical activity and healthy eating across the community. Strategy 3, improve mechanisms for purchasing from farmers markets and farms to make fresh produce more available in all of our neighborhoods. Strategy 4, Increase and promote healthy food and beverage options in schools, the workplace, child care centers, and after-school programs. Strategy 5. Increase support for breastfeeding. Babies who breastfeed are less likely to become overweight later in life. Employers can make it easier for women to continue breastfeeding after they return to work. Changes need to be made to the physical, social, and policy environment to create a community where healthy choices are the easy choices. Not only is it possible, it's happening right now in communities around the country. And Allen County is next. Getting involved is easy because the movement has already begun. Change is already happening. Sign up and find out how you can help create a healthier community. One person, one organization, and one neighborhood at a time.
I think if we could give Core Comp a round of applause. They put this together for us. The other experience I had at Washington, D.C. was meeting the gentleman to my left, your right, Mark Fenton. You want to talk about high energy, everyone in this room better hold on because he ate today, so his energy level's even higher. I don't know how it can be any higher when I've seen him in action and what he's able to do. Mark is a transportation planning and public health consultant. He's an author. He's on PBS television host and an active transportation advocate. I think the key with him, he serves on the faculty for the University of Southern Carolina annual physical activity and public hearing training course, works with Safe Routes to National training course, and as a workshop facilitator for the National Center for Bicycling and Walking in Washington, D.C., leading sessions in over 200 communities. And those walkabouts are pretty amazing. I had the opportunity to experience that one in Washington. When you look at what we don't know, we don't know. And I think that's important for us to keep in mind. I'm excited and thrilled to have him here. His resume could go on and on. I have about 6 pages, but I'll leave it at that because I want you to be able to hear from him and hear about what opportunities we have here in Lima, and I guarantee you he will challenge each and every one of us to get out of our comfort zone. So without further ado, Mark Fenton.
Thank you.
Mike's right, because I was able to have some lunch, I can't sit still now, so I'm not going to stand behind the podium. It's a real pleasure to join you. It's a privilege, and I especially want to thank those of you that have taken some time to visit with me over the last day and a half. I got to tour the area so that some of the pictures you're going to see in my slides are familiar, will be familiar, and I'm also going to forewarn you right now. My goal is to make everybody in this room uncomfortable at least once during my comments. If you aren't, then I'm not doing my job, because we have a big problem, summarized in that video that you just saw, and frankly, it is our job to do something about it. So I'm not kidding when I'm saying we should not be happy with that. That should not be evidence that we're comfortable with. And I want to make clear why. Now, having said that, I'm going to open with a little story, kind of a goofy story. You see the picture here of some colleagues and I. Last year, I happened to turn 50, and I have a good friend who's an editor at Backpacker magazine, and I'm somewhat of an avid outdoors hiker, backpacker kind of guy. And every year he comes up with, concocts some idea, some challenge that we have to do. And yes, last year, because we were turning 50, he said, I think we have to try to do a 50-mile nonstop hike. Now, we've done some crazy stuff in the past. We've hiked from the south rim to the north rim of the Grand Canyon and back nonstop down to the river and up. Kind of wild stuff. But this idea of hiking across Zion National Park from the northwest corner to the southeast corner, literally 50 miles nonstop, I thought was pretty daunting. By the same token, I thought I had to try it. Interestingly enough, and by the way, it would be fair to ask, you know, under what basis does he invite you, some scrawny guy, to try this with him? Well, it turns out I do have a resume that includes some experience with long-distance athletics. In fact, I used to be a competitive athlete in the most bizarre of all track and field sports. So this is my moment of confession, a little confession. I did the goofiest looking sport in track and field. I used to be a competitive race walker. And you can see here, photographic evidence, you're allowed to laugh. It's the silly looking one that you see with the arms and the hips and all that. And you can tell it was a very long time ago that I used to compete. This is evidenced by the fact that we only had black and white photography back then. And the other giveaway is that those shorts were actually in style back when I was competing. Really, they were back in the 1928 national championships that you see pictured here. Many people will ask, Mark, why race walking? I did the 50-kilometer race walk, which is a 31-mile event. And the answer is obvious when I show you the next slide, so look closely. Why was I a race walker? Well, of course, it was the huge crowds that showed up at our competitions. And I'm not kidding when I tell you this is the start of the 50-kilometer race walk at the 1984 Olympic trials. So that's the LA Coliseum. Los Angeles, you may remember, hosted the 1984 Olympic Games. And if you look very closely, by the way, I know at 6 in the morning, they start us very early to avoid the heat of the day, like the marathon runners. And you go out and do a loop around the city. You come back in and finish in the stadium. But they started us there. And if you look very closely up above the Kodak symbol there on the far side of the stadium, see those two people? That would be my mom and dad there, cheering me on at 6 in the morning. Way to go, sweetheart. So I'm telling you this because, so theoretically, at least I have some background in endurance athletics. I've done these kind of long hikes with Mike before. Interestingly enough, when I proposed to my family this idea, the thing that I am most excited about, thrilled about this hike is not that we took on and accomplished this 50-mile hike, but that, and here we are midday at about the 31-mile point, still, 19 miles to go to get to 50, that my daughter and my wife both volunteered. One of the things you do when you do these long distance hikes is not try to carry too much. And my daughter, 13 at the time, said, Dad, I'd like to be one of your support people, hike in, intercept you, give you water replenishment, food at a couple of points along the trail, which you really need on those kind of hikes if you want to keep your pack very light. And she said, and I also would like to meet you at Angel's Landing, which is that fin of rock right there. It's called Angel's Landing for a very good reason. It looks like only an angel could land atop it. There is a very, very narrow, dangerous path, as you can see from the warning sign. And she said, but you are allowed to go out there. The Park Service allows you. There are some chains and ropes in certain locations. It's really a technical climb. And there's my daughter making light of the warning sign on the right. And she said, I want to meet you and do the hike out to Angel's Landing and back. And I thought, that it's going to be pretty scary, kiddo, when we get up there. When you get that last half mile is, it's literally, in fact, it's like that. There are points when that's a 1,000-foot drop to the valley floor, and you're right on the edge. And that'd be my wife nervously sort of pretending to smile, but thinking, gritted teeth, why are we out here right now? And as I show you these pictures, I show you because you might say, I should be calling social services on this guy. What is he doing? What kind of a risk is he exposing that child to, that young woman, that 13-year-old to, on that precipitous cliff right there? And I want to tell you with certainty that that is not the greatest risk that she nor her generation face. The risk they face is the fact that 1 in 3 kids born today are going to end up with type 2 diabetes. A disease we used to call adult onset diabetes. But we can't use the term adult onset anymore because we see it in 9 and 10-year-olds. A disease we thought you couldn't get till you were 40. My daughter's risk is not that she's going to fall off the edge of that cliff. Indeed, I think she's lucky to be in a family where she's exposed to a lot of physical activity, and I am blessed that she's inclined to it, that she's the kind of kid that wants to go hike with me, and we go for runs together now. She likes bike riding. She's an active kid. Unlike so many American kids today. That's the story. That's the risk that she and her generation faces. So I'd like to touch on these 3 or 4 topics to sort of give context to this. I'm going to ask you to get a little bit of perspective on my bias here. I'm going to share just a little bit of public health data, 3 numbers, and then I'm going to talk about what we know about how to build healthier communities, because that's really the interesting story, and I'm going to ask what you're going to do about it. Because that's really the interesting question. What will you do about it? Because I leave tomorrow. The question is, what will you take on? So let me ask you to engage in a little exercise for me, if you would. Think back to your earliest fond recollection of having been physically active as a youngster. And I'm not talking like high school sports, making winning the state championship. I'm talking really little kid, your earliest recollection of having been physically active as a little kid. Get that in your mind. Now turn to the person next to you, share your recollections, and if you can, act it out. Right now, 20 seconds, go. Early fond recollections. Where'd you guys from? Where? Like backyard? On a team? Okay.
Bike racing around the neighborhood.
Baseball in the front yard. Riding my bike all over town.
All everywhere. Good. What'd you guys say? What did you say?
We're playing baseball between the house and the barn. Out in the park.
I can go seek in the Catholic Church.
Okay, bring it back in. Now, I know it'd be far more interesting to spend the next 30 minutes having that conversation than having to listen to me, but I'm going to ask you to indulge me, okay, because there's a method to my madness. I want to ask a series of questions about your recollections, and I want you to raise your hand if your answer is affirmative, okay? Raise your hand if your answer is affirmative regarding your thoughts about that time in your life. How many of you recall called an activity in which you were only with kids of the same age and gender? So if you were a 10-year-old boy, you were only with 10-year-old boys. Hands up for that. How many remember an activity that occurred at a designated time and place? You had to be at a scheduled location to do the activity. How many remember an adult having to be present to do the activity? Hands up for that, adult present. How many had a uniform for the activity that you had to wear? You were given a shirt or something you had to have on. How many remember there having to be an umpire or a referee for the activity? Hands up for that, umpire or ref. How many remember an activity where you were with kids of different ages and different genders? So older kids, younger kids, boys and girls, whoever you could get your hands on to put that game together, or that pickup ball game like a couple of these guys were talking. How many remember not necessarily having an adult present to do the activity you were recalling? How many could not have gotten away with the activity if there had been an adult actually present? Yeah, I thought so. How many of you are elected officials? I'm curious now. How many of you remember an activity that included a wheeled vehicle, a bicycle, a tricycle, a big wheel, a skateboard or a scooter, maybe one that you made, a go-kart? How many remember an activity that involved water, either swimming in it or fishing in it or damming up maybe a neighborhood creek or chasing salamanders in the pond? Anybody have those? How many of you had a place that was the kid place you went to? It could have been a fort in the woods or in the fields, or it could have been a ball field or a neighborhood park or a space that you guys, or even an empty lot where you played the pickup games. Yeah, anybody have that? How many of you, if you'll indulge me now and allow me to use a term of art that is probably familiar, maybe not in this context, how many of you remember having been a free-range kid to some degree or another? Who could disappear on a Saturday morning with their buddies on a bike and maybe not show up till either lunch or maybe even dinner? We used to have a be home when the streetlights came on rule. Did anybody have that rule? The streetlights, some nights? My last two questions are the most important questions of the day, so I'm going to ask you to listen very carefully. How many of you believe the majority of children growing up today are living free-range kid lifestyles? The majority of kids today, free-range kids. Look around. Look around. Look how you're voting. Okay, last question. How many believe it is good for the health of American kids that they are not free-range kids? I want to be clear that it's a good thing. We're fighting the childhood obesity epidemic by not having free-range kids. Hands up for that. Let's think about what we just said. As recently as a generation or so ago, we are not that old in this room. Generation or two ago, we had free-range kids and lots of them. Now we don't, and we agree it's not good for them. My simple question is, what are you going to do about it?
Get rid of the TV.
Get rid of the TV. Quite frankly, it's a great idea, and it won't be enough. Because the TV, I believe, is as much result as it is the screen time, is the fact that we've built a world where we don't feel like they can be free-range kids. Indeed, let's be very clear about this. I am not the only guy talking about this. Lots of really thoughtful people are out there. A guy named Richard Louv, the picture in the top right, wrote a book called Last Child in the Woods. He actually coined the term nature deficit disorder. He is so concerned about kids, and he doesn't think we have to get kids drugs for it, thank goodness. He says we got to get them back outside again. He catalogs the physiological complications that come with kids not having time outdoors, higher rates of obesity and type 2 diabetes and all of this. Shane Gould, who's an former Olympic swimmer in Australia, I spoke at the Australian National Physical Activity Conference when I was over there. She came out to say, I think kids are held back by over-organized play, by everything being a regulated game that starts and ends with adult supervision. She goes, where are the skills? Where are the skills such as the innovativeness and creativity of making up your own games, the leadership skills of picking teams, the negotiation skills of dealing with arguments when there isn't an adult there to tell you. All the stuff you guys had to do, all of you who said, yeah, we used to play pickup games of baseball, all skills you use as leaders in your communities today that you started developing when you were a free-range kid, that kids today don't develop when this is all they do to play, when they don't have any of that interaction. There's really interesting stuff about this. Now, that's all really interesting, you say, Mark, but gosh knows, if you ask a bunch of parents, why don't you let your kid walk to school? Why can't Timmy disappear on Saturday morning with his bike and his buddies? Why is it so different now? And you say, why don't you let your kid live that way? Their first answer is what? Safe. It's not safe. Oh my God, there are horrible, scary men with big, thick mustaches hiding behind every tree. Creepy guys, digital cameras and mustaches, right? right? I'm not making that up. So I need to ask this quick question. What is the percentage increase in violent crime against children by people who don't know them over 30 or 40 years? Let's pick the time span from 1970 to 2000. Let's pick that time because it happens to be the time in which, as the red bar shows us here, the percentage of kids, the green bar, the percentage of kids walking and bicycling to school went from 40%, over 40%, to roughly 15% of kids. And over the same time span, the red bar shows us the percentage of kids being driven to school goes from 15% to approaching 50%. Over that 30-year time span, the increase in violent crime against kids is, wait a minute. By the way, it also happens to be the same 30-year time span in which childhood obesity rates tripled. Precisely the same 30 years. Don't tell me that's circumstance. That dramatic change in how kids get around, 30-year time span, the increase in violent crime against them is what? If anything, it's gone down, the gentleman says. We can find no data that says it's increased. The only data we can find that's longitudinal suggests it may have gone down. What is different, by the way, over that 30 years? We're petrified. We are, as one of the guys I work with says, marinated in fear. Parents have been marinated in fear for the last 20 or 30 years. There's an Amber Alert in California. You hear about it here in Ohio, right? And then you don't hear that it was actually a custodial battle and the kid's fine. And I'm not trivializing it. As a dad of a 15, now 16 and 14-year-old, I am very careful about where my kids go and with whom. They have all the skills around stranger danger. I'm not saying there aren't neighborhoods or streets or places kids shouldn't be alone. I get all that. But this notion that the world is vastly more dangerous now than when we were kids, and then we use that to give up, to throw our hands in the air and say, yeah, go ahead and sit in front of the TV, is a total cop-out. Now, there are differences. Would you not agree? Roads are wider. Traffic's faster. There are a lot more cars on them. Interestingly enough, as opposed to the imaginary fear that I can't change, that's something I can do something about, isn't it? I could change the physical landscape so that it might actually be better for a free-range kid to be out there. And indeed, that's at the heart of my conversation with you today. I'm going to suggest to you basically 3 numbers characterize what we're up against. 30, 20, 365. 30, that's the minutes per day we're told every American should get at least that amount of physical activity. We're not talking, by the way, about training for a marathon. We're talking about going out for a moderate daily walk of about 30 minutes. The evidence even tells us you could break it up. So if you were somebody who could walk your kid to school for 10 minutes in the morning, if you work downtown, walk for 10 minutes at lunchtime to do some errands, and in the evening, walk your dog for 10 minutes. If you accumulated those 30 minutes, it would give you the same risk reduction as far as reducing your risk for cardiovascular disease, type 2 diabetes, osteoporosis, a growing list of cancers. That's the good news. You want to hear the bad news? 20 is the percentage of American adults that we think actually get the 30 minutes per day. That's probably an overestimate because it's based on telephone survey data in which we know people tell us what we want to hear when they do the surveys, the Centers for Disease Control. People tend to exercise more. They also tend to be taller and weigh less than when you actually measure it in real life. I'm not kidding. They've actually done validation studies. Only 1 in 5, probably more like 1 in 10 of us, get the 30 minutes 5 days a week through what we call leisure time physical activity, conscious exercise. The 365, what must that be? Days of the year that we should go out and be active and eat a healthy diet, right? Here's the bad news. Add 3 zeros in its estimate of the number of people who die prematurely due to the diseases associated with sedentary living and poor nutrition. 365,000 or more. It is second only to tobacco, which kills about 400,000 Americans prematurely. Here's the really scary news. The tobacco numbers are plateauing as fewer and fewer of us smoke, while the inactivity and poor nutrition deaths continue to rise. Next time they run these numbers, physical inactivity and poor nutrition will be the #1 cause of premature death in our society. All we have to do is ask a hospital administrator what fills 60 to 70, maybe even 80% of the beds in their hospitals. They will tell us it is the diseases associated with sedentary living, poor nutrition, and tobacco, the big 3. Yes? It's not avian flu and Ebola and infectious diseases of unhealthy lifestyles. I'm not exaggerating. When we bust the Medicare and Medicaid trust fund, it will be those 3 that drive it down the hole. Indeed, here's my last bit of tirade on this, if you'll allow me. If you have the ear of a federal legislator and ever have an opportunity to talk about health care and how we do it in this country, and they ask the question and want to argue with you about whether Obamacare or Romney Care or a total market-based system, what's good and what's bad, tell them to shut up. That talking about how we pay for it and who really pays is like rearranging the deck chairs on the Titanic as it speeds full speed into the iceberg until we deal with these three underlying behaviors: physical inactivity, poor nutrition, and tobacco. I mean that sincerely, because it won't matter. It won't matter where the dollars come from in the end, because we'll run out wherever they're coming from. Now, having said that, you should ask, Mark, why are we having this problem? We all know exercise is good for us. People like you are out there, TV shows, videos, blah, 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 blah. Clearly, you're a little hyper about this. You get the message out. The answer is quite simply that simply telling people to exercise, or for that matter, eat a good diet, doesn't work. Here's a little interesting study done at the University of Pittsburgh's Medical Center that tried to get people to walk 40 minutes a day. All you need to know is it's a graph of exercise minutes per week versus the 18-month duration of the study. And what is notable is they had a 6-month intervention where they called them on the phone and reminded them to exercise and gave them prizes like T-shirts and water bottles. We love doing that in health promotion. Giving out T-shirts and water bottles, right? Who's gotten or given a T-shirt or a water bottle for doing something healthy? Hands up, just out of curiosity. Of course, because we do that. What you see, by the way, is that although we get a short-term change in behavior, it doesn't stick. There's a massive drop-off. Happens all the time in these kinds of studies. Simply scolding people to exercise and eat better has not worked. We've got 25 years worth of data. All of it looks basically like this. What we really have to think about is it really about exercise, or is it how we live our daily lives? And Mike and I were just talking about this beforehand. He talked about changes he's made in his lifestyle. And it's not about getting on a diet. It's about eating better all the time, because that's how he thinks about eating. It's not about, sort of exercise. It's about a walk being part of his day every day now. That's just the new normal. These people, these are reenactment sort of historical museums in Massachusetts. One is Plymouth Plantation, where the Pilgrims landed at Plymouth Rock. The other one is Lowell National Historic Park. It's an Industrial Revolution era water-driven mill. And I got to tell you, after looking at the people working there and thinking of the 12 and 14-hour days they work, I'm thinking after 14 hours at the loom in the mill, you didn't have to, after working 14 hours, you didn't come downstairs and go, well, better head to the gym, do a little lifting. They got their physical activity as a part of daily life. It is a very recent phenomenon. In an agricultural region like this, it is only very recent that you don't get a lot of your physical activity in the work of farming, right? That's only in the last few decades that we've automated all of what we do so much. We need to think about building physical activity back into daily lives. And that's why when people say, so what do you want, a gym in every workplace, Mark? You want a treadmill in every house? No, the data already tells me that's not going to work. What we need is to rebuild our communities in such a way that we get physical activity every day without even thinking about it. That may not seem entirely intuitive, because we've become so accustomed to sort of trying to minimize our daily energy expenditure, but this is really where it's at. Now, you should be pressing me now. At this moment, you should be saying, okay, smarty pants, fast-talking guy, is there any evidence that you can actually build such places, that if we build it, they will come, that if we design our communities in a certain way, people will tend to be more physically active without even consciously deciding to? And my short answer is yes. There absolutely is. This is what I study. I know it well. Basically, those 5 things characterize communities, designs, where people are more physically active as a part of daily life. Right? And what you see is these 5 things. 1, there's a greater variety of destinations within proximity of one another. 2, they are good connections between those destinations. When you get to the destination, it rewards you rather than punishes you. It is safe and accessible for the person who chooses to walk or ride a bike or take the bus rather than get in the car. And throughout that system, healthy food choices are affordable and accessible. This doesn't sound like rocket science, and I'm able to illustrate most of what I'm talking about with photographs from right here. Traditional compact neighborhoods. Think of your traditional downtown neighborhoods at a grid network with sidewalks on every street. That was very common, and it was exactly the kind of design that caused us to be able to walk to school, walk to a park, walk to the library, to the corner store, to the school. We even had typically mixed use, what we call mixed use in our downtowns. Retail on the first floor, housing above. It was very common for a store owner, even in small towns, right? Even in the little main street small towns of the county,